Being simpletons. You might be watching this thinking that we're just starting to record another podcast episode with Dr. Jamie Moncrief. However, being the simpletons we are, we've just been talking for an hour and 10 minutes and then realised that Jamie's mic was not on. So after about 30 seconds of crying over spilt milk, we just got on with it. So let that be a lesson to you. Sometimes wasting energy on things that you have no effect on isn't serving you. So welcome back, Jamie. It's a Pure Waffle podcast. I've already written down a few things that we spoke about in the last hour and a half. My mouth now is as dry as the Sahara Desert, and I'm definitely going to need a piss at some point, which I thought I probably would have been able to hold off. But second time in, you've had a couple of videos that have done well, haven't you, on your TikTok channel? You've taken some clips from our last conversation. What's changed in your life? When were you on last? Was it last Saturday?
I think it was a week ago.
It was a week ago today, wasn't it?
7 days.
What's changed in your life?
Well, ultimately, that video blew up.
Yep.
It's interesting, isn't it? Because suddenly, I'd never done TikTok. And the first video I put on that account was 135,000 views or something ridiculous like that. It's interesting, isn't it? Because I've had people from completely different parts of my life who have seen me on it, and they've messaged saying, I knew I recognised you. And it's really odd. I bet you've had exactly the same thing.
Yeah. All the time now.
Yeah.
All the time.
Do you not find it
out
strange
in public
that people who just essentially no longer form any part of your current life just pop up? You're like, oh, I remember you because I've seen you online.
Yeah. I mean, obviously I'm 45 years old, so I see that more and more now anyway, just in general life. You'll put something on Facebook and then somebody will pop up that you've not spoken to for 20 years. But we're all just so interested in our own lives, aren't we? That's ultimately what it is. But yeah, it's a funny one. I think also what a lot of people don't realise is when you film on TikTok, it's like looking in a mirror. So it reverses you. So you look normal to yourself when you're filming a TikTok, but the reality is you're reversed. So when people see you in real life that have only ever seen you on TikTok, it's almost like, you look a bit different. Is that really you? Is it not you? So I've met a few people that have only ever seen me on TikTok, and they're like, you look kind of different. But it is because of that. It flips it like a mirror does. So you don't see yourself how everybody else sees you. But I mean, I'm digressing a little bit. But yeah, it is odd. It's strange. It's funny because, we don't really need to go into what your video was about, but you had a little bit of hate. And I've said to everybody that I've coached recently that when you embark on this journey of putting your life on a social media platform that everybody in the world essentially has got access to, you're going to piss somebody off and you're going to have people that disagree with you. So choose who those people are going to be. If you went to an MMA training session and Group A was a group of, actually I've got a funny question as well for you on this subject. Group A was a group of 10-year-old boys that have never fought before, and Group B was a group of 10 45-year-old blokes that looked like they'd been in a good couple of fights or two, and you had the choice of which team you wanted to fight. We know who it's going to be, don't we? You're going to fight the 10-year-olds.
Where on earth does that question come from?
Because when you're producing content, pick who you're going to have your fights with.
Right.
So when I make a video about flat earthers, I'm picking the 10-year-olds, aren't I, really? I know there's going to be blowback and there's going to be hate, but I don't want to start talking about things that might be going on the other side of the world, because when my opinion pisses somebody like that off, I've got a whole world of problems that I'm going to start to face. So I'm essentially saying, pick who you're willing to have these fights with, because you are going to have these fights. So I had my fights with the LTA, didn't I? Yes.
What happened?
Well,
Right,
essentially
briefly.
somebody found my TikTok videos and it was in the period of time where I was really just experimenting with content. So I was, making content that was talking about daily stuff, or Andrew Tate was prolific at that time. So I'd read one of his tweets out or something that kind of got a lot of traction, but obviously his views, which in hindsight, I should have said at the start, this is an Andrew Tate tweet. Instead, I just read it out. So people are going, well, is that your opinion on this? I think it was, here's 5 things that every young man needs to prepare for.
Was that from Andrew Tate?
Yeah, it was a tweet, yeah.
I didn't know that.
Yeah, exactly. So that's my mistake that I made. But anyway, long story short, the LTA looked into it. They said, look, there's nothing, you've not crossed any lines in terms of child protection or, whatever. So there's nothing they can do. They just said, just be careful of the kind of stuff that you put. I guess it would have been the same if I was, saying I was anti-vax or I was pro-vax during the pandemic. Just be careful what kind of stuff you're putting out, because you're putting your personal name to it. So that was that. But obviously since then, you learn your lessons, just like we've learnt our lesson, haven't we, Ben? To switch the microphones on. And it's a learning process. But during that learning process, if you are mindful of the battles that you are going to have to face, and you're prepared for battle, and you're confident that you're capable of winning those battles, then it's all good. But here's the little question I wanted to say to you. What round, hypothetical, what round do you think you could reach? It's a fight to the death. Round 1 is 1. Round 2 is 2. Round 3 is 3 of these people. And they are 7-year-old kids. What round do you reckon you'd get to until you were overwhelmed? And these are horror movie, nightmarish creatures that are trying to kill you. There's no weapons involved, but they are just 6, 7-year-olds.
Have you got weapons?
You've got no weapons, no.
And neither have they.
No weapons, no team has got any weapons. As soon as you've defeated round 1, 1 kid, then it's round 2, 2 kids, then it's round 3, 3 kids, round 4,
No
4
rest.
kids. No rest. Where do you reckon you get to? It's a great question, isn't it? I'm going mid-100. 120, 30, 40. Because you're going to be overwhelmed. But these are simpletons, aren't they?
You could take 120.
Yeah.
I mean, we can all agree I'd be swarmed long before you would.
Yeah, but I think because you'd be more agile than me.
I would be more
You'd be
agile.
able to evade,
environment.
take one down, evade, take the other down. You know what I mean? Whereas I'd be bogged down with too many.
I mean, I'll give you an example. This table, I'm not sure they could be able to climb on it.
Exactly. So you're on the... Yeah, that's what I'm saying. So they're just normal. So you could pick them off one by one.
There you go, infinite.
And it's a little bit along the lines of zombie apocalypse. So Jamie and I have known each other for a long time, many years, and we've had many strange conversations. And we have got a full plan for if a zombie apocalypse does happen, haven't we?
I have got that.
We know where the local guns and ammo shops are, how close they are.
I don't know where they are.
Yeah, we do. We looked them up that night. There's one in Leicester. There's one in Birmingham. The one in Loughborough's, yeah, it kind of is okay, but I don't think it's got enough high powered. We looked at it and it told you all the stuff they've got downstairs.
I do vaguely remember having
I think
that
you probably had one
conversation,
too many drinks, hadn't you? It's rather noisy in the Pure Waffle podcast today. I don't know if you can hear the background laughing. They're not laughing at Ben's haircut. He's had his new mullet trimmed. So it's a little bit like that. I'll let you ponder on that one. Anyway, anything else changed this week for you? Anything decent? Where's Millie today? She working?
No, just back in Bath. I'm going to go and see her later. Trying to think what else we have then. So, yeah, it's been quite an interesting week.
Yeah.
Almost certainly sent someone with active tuberculosis up to the hospital.
Really? What's that? That's a lung disease type
Yeah,
thing,
it's
isn't
not
it?
exclusively to the lung, but it's an infection that affects 1/3 of the world's population.
Yeah.
Cardinal symptoms are weight loss, cough, any sputum that comes up with blood in it is very, very worrying. Ben,
Yes.
how much do we? Can you hit? Can we?
It's fine. You won't
That
be able to
noise-
hear them, really.
No, it's just for you and me. It's very loud.
Yeah. it's
Yeah. So this patient came in coughing up blood, weight loss, muscle aches, generally feeling unwell, very, very tired. They had a history of tuberculosis. They'd had some recent travel as well. Almost certainly was.
What countries is it rife in?
It's a good question. It's common in Africa. It's recommended. I mean, Ben, you'd be able to Google this. Where is the TB vaccine recommended for? I think it's Africa, South America.
Yeah. Parts of Asia, India, probably.
It will be parts of Asia.
Yeah.
It's common in India. Yeah.
Yeah.
It's on the rise in this country as well because we've not vaccinated against this disease. We've not vaccinated against this disease.
I'm sure I had a
Years.
TB jab when
Yeah,
I was at school.
Yeah, Ben hasn't.
Is that the one that you get the Heath test for? What was that one for? So the nurse would come in and you'd have this little thing on your forearm.
Yes,
and it was like
yeah,
6
that's
needles.
exactly what it is, yeah.
And if that reacted, then you didn't have to have it. And I didn't. So my Heath test came up. I didn't have to have the TB jab. TB, tuberculosis, yeah.
The reality is we've not vaccinated against this disease in a number of years, and as a
For what reason? Cost.
I think it probably is cost. We vaccinated against it so much that the prevalence of the disease was shrunk right down.
Right.
But now we've not vaccinated against it in who knows how many years. Immigration has increased, particularly the relevant immigration is immigration which has come from areas which have a higher level of
Yes.
TB.
So now all of a sudden it's taking root again.
I mean, I've seen at least 5 patients with active TB in the last year.
Wow. And can it kill you? Yeah.
Oh, it can kill you.
Yeah.
How long does it take? How many antibiotics do you need to cure most diseases? Do you
Like a
reckon?
week, isn't
About
it?
a week.
Like a week's dose.
TB, it's about 4 to 6 months.
Wow.
Ben, we have a look. How many months of antibiotic therapy is it for TB? It's about 6 months.
Wow. As opposed to a week, 2 weeks max for most other things. And is that the same antibiotics? Will it be your floxicillin or whatever it is? 6 months of antibiotics for TB.
So it takes 6 months of antibiotic therapy and
Wow.
multiple antibiotics to cure the disease.
Wow. That is interesting. That's
Yeah, it's unbelievable.
incredible.
But you can tell by it, for anyone who's ever had the TB vaccine, you've got the mark in your arm. You can see how difficult it is for your immune system to clear it up.
Yeah, I've
It's
seen
just-
people with it's like a crater
It's
in the side of
unbelievable.
their
It just
arm.
burrows itself so effectively that we just can't clear it. 6 months of antibiotic therapy. It's like a chemo regime.
Yeah. My sister's just finished her chemo and she was only, I think it was 5 or 6 weeks.
So 4 times longer.
4 times longer. Obviously not as damaging to the rest of your body as chemo would be. Antibiotics?
Oh, antibiotics. No, but it's still a serious undertaking. Consistent antibiotics has been shown to raise your chance.
Mm-hmm.
Multiple antibiotic therapy has been shown to increase your possibility of certain colon cancers.
Yeah, of course.
And other gastric cancers as well.
And is that because, you see, I've heard that once you take a course of antibiotics, it takes about 6 months for your gut flora to come back to normal. Would that be part and parcel of it? Possibly.
So the reason that antibiotic therapy does cause certain cancers or is linked with certain cancers is for that exact reason. It's your gut flora. So if you can imagine that there's a whole host of bacterial organisms, of bacteria living within our gut, most of them are completely harmless. Some of them are pathological, but the population is kept so low by competition with other species of bacteria that we don't go on to develop any pathology. When you have antibiotic therapy, different areas of different types of bacteria are killed to different extents, and therefore the recovery is also different. For instance, some populations regrow quicker than others. I'll give you an example on that. You're not supposed to use, you shouldn't use soap with thrush therapy, and the reason is that it's the thrush spores that grow back quicker. So that's another factor when you use antibiotics in your stomach. Different bacterial populations will be the ones to recover quicker. once you've done that, you can have overgrowth of certain populations, which then do go on to cause symptoms that you wouldn't have before.
Mm-hmm.
Any amount of inflammation will increase your possibility of cancer because the body has to do more healing and there's more regenerative cycles. And if you're going to go through more regenerative cell cycles, there is more possibility of an error coming in as a mutation and therefore causing a cancer. So that's the explanation behind it.
Wow. So coming back to gut flora, I've recently embarked on a new diet. So you and I have both been plant-based, vegan-y for a number of years. I was full vegan for 2 years and then vegetarian for a couple of years, 2.5 years, let's say. And my knees are full of arthritis, tennis coaching for a number of years. And it's just getting to the point now where it's unbelievably sore to the extent where I can't run, I can't play tennis anymore, can't do anything. So I was watching, I've been looking into various different things. I don't want to go on 10 anti-inflammatory and pain-killing tablets a day. I don't think that's a long-term solution. And at 45, a knee replacement, I'm not entirely sure, again, is the right move. So I was watching, in particular, Dr. Sean Baker, episode 2069 on the Joe Rogan podcast, and he's an orthopedic surgeon who advocates using as a therapeutic tool carnivore diet for a month to 2 months, and he said he's seen unbelievable results with people with arthritis, joint pain, things like that. So I started it last day of November, which is 3 days ago, so I'm on day 3 now, and my knees are not hurting me. So coming back to the gut flora, evidence would suggest that probably a carnivore diet is not the best thing for gut flora. What do you think? What do you think about the evidence-based, and yes, it's anecdotal at the minute, but like I was showing you earlier on today, I was doing backflips and cartwheels in here, wasn't I, earlier on today? Well, I was bending down and touching my toes for the first time. I've done that properly for quite a while. What do you reckon about that?
So, well, what do I think in relation of a carnivore diet to curing arthritis?
Yep, and gut flora and longevity of it and all of that jazz.
I think that I don't understand the mechanism behind it, but good science is good observation.
Yep.
And therefore, if we're starting to observe results in a certain patient group with this particular pathology and this diet is improving their symptoms, then my opinion is, who am I to say on any level that that's not relevant? It's probably incredibly important. I've not looked at the evidence, but as I said, good science is good observation.
Yeah.
And discoveries start with observation. Penicillin was discovered when a mushroom spore blew through the window onto a Petri dish. And was it Edward Jenner?
Yes.
Or was that Bruce Jenner's brother? Have I just made someone up? And they observed that the bacteria was not able to grow where those spores landed.
Yeah.
That's observation, isn't it? So if you have an observation which appears to yield results, then the scientific theorem and discovery comes from that. Exactly,
Yeah.
then test it. So that's what I think about it.
Which is kind of what we were talking about before Ben forgot to turn the microphones on.
Caitlyn Jenner, sorry.
Caitlyn Jenner's brother. Is a lot of the studies that say that meat is bad for you or X is bad for you are not eliminating processed foods from the diet. So we were talking about this earlier, weren't we? That if you put somebody on a plant-based diet that consisted of Burger King's meat-free, whatever they call it, Whopper, for 10 years, compared to somebody that was eating McDonald's cheeseburgers, they're both probably going to be very unhealthy and die early. But factoring in somebody that's eaten a purely vegan diet that is homegrown organic food compared to somebody that just eats a normal Western diet, which is meat, but 80% processed bullshit, and then saying, oh, a meat diet compared to this is not as good for you, it would be interesting to see the studies, if there are any, and I'm sure there are countries out there that they live predominantly on the meat, that is grass-fed, hand-reared, free roaming, and compare that to somebody that is living this organic, I'm growing my own crops in the garden, everything's homemade. I wonder what results that would yield.
Yeah, I agree. It would be interesting to see. I think the closest thing would be a Mediterranean diet, not
Yeah.
because of the fact that there's not an awful lot of meat in it, but it's probably the closest thing as to
What's
what you're
that?
saying.
300 cigarettes a day and 2 bottles of wine.
Live to 90 years old, 2,000 words to discuss. So it's a minority of meat. They exclude...
It's mainly fishes and things, isn't it?
So
Fish,
it includes
seafood.
Meat. It includes a small amount of meat, an even smaller amount of red meat. There's slightly more fish involved. There's chocolate, red wine, and the main staple of the diet is fresh vegetables, legumes.
Olive oil
like
as
that.
well.
Olive oil is a key part of it as well. It's involved in all the cooking. And that certainly is much more healthy than a typical Western diet. But as you said, it's one of the main factors is the exclusion of processed foods.
I think it's probably the quality of food rather than necessarily what the food is.
The exclusion of processed food is the most important thing that most people could realistically implement into their diet nowadays. Regardless of whether you want to eat meat, you want to eat plant-based, whatever it is, the more processed food you incorporate into your diet, the more inflammatory particles that you're ingesting, and therefore the higher your risk of certain complications are. This increases the risk of strokes, heart attacks, arthritis, dementia, pretty much anything that we've ever heard of. Okay, obviously that's an exaggeration, but your diet is one of the most important things that you can control.
Diet, physical activity, and sleep.
And not smoking.
If those 3 things are on point...
And not vaping.
You're going to do everything better.
Yeah, of course.
You know... Would you rather die at the age of 60, having lived to the fullest up until 60, eating and doing certain things, or living till 90, but those last 30 years you can barely get out of bed? You know, it's quality, not quantity in a lot of things, isn't it? And those 3 things are paramount. Yeah,
of course.
And I think sleep, actually, not really something we touched upon either.
Sleep is unbelievably important.
Sleep is the key. Have you read the book
Why We Sleep? I'll give you a fact. This is really interesting. How many people out of the 100 do you think can sleep 6 hours a day and show no signs of sleep deprivation?
How many people out of 100 can sleep less than 6 hours a day?
6 or less.
Can sleep 6 or less and show no signs of...
Sleep deprivation.
0?
0.
Is it 0? Okay, because I've looked into this, I've read all of these books, and I understand how important it is. It might have been you that said this, but it might not have been you. But the increase in chances or the chance of you getting heart disease or cancer, the significant increase if you're getting religiously less than 7 hours a night or something is off the scale. You know, it's not like 10% increase, it's like 500% increase or something stupid like that. Which is amazing, isn't it? Because it's a part of everybody's life that I guess in many ways is neglected, particularly as an adult. Lots of caffeine, lots of alcohol close to bedtime. What kind of effect does nicotine have on sleep? Does it have an adverse effect?
I would have thought so. I mean, essentially nicotine levels.
Is it a stimulant? Is it a stimulant?
I mean, it actually relaxes people. The thing that I find most frustrating about smoking is that it is used to restore nicotine levels. Now, you and I don't smoke, therefore our nicotine levels are very stable. Let's say a typical nicotine level, if you can imagine a graph runs across like this. When you have a chronic smoker, if they don't smoke, that happens is their nicotine level drops to a much lower baseline, and therefore when you have a cigarette, you're only having one that puts you back to around a normal level anyway.
So
that's
do you and I have a nicotine level in our body then?
Yeah, of course. Yeah.
Because tomatoes contain nicotine. Did you know that?
well, nicotine is a compound that's found in lots of things, but but that's the thing that's so frustrating about smokers is chronic smokers get to a point where they're having a cigarette just to feel relaxed as everybody else anyway, because all they're doing is restoring their nicotine to a level that it would have been had they never picked up a cigarette.
Which is similar to people that drink a lot of alcohol.
Yeah, it's similar to all drug addictions.
Yeah. You know, I know people that can drink 8 pints and you wouldn't know that they've even had a drink.
Yeah.
Because they've been drinking 8 pints for 25 years. Whereas somebody that hasn't, 1 pint and you notice it. So, you know, if you and I go and have a cigarette now, our nicotine levels would be, I don't know, does it send you off your head? I don't know, I've never smoked. It must give you some sort of buzz.
Nicotine withdrawal is genuinely terrible. People
Is it?
feel unbelievably anxious, shaky. They can't focus on anything. They cannot organise their thoughts. And the reason is that they're not getting that relief that cigarettes or vapings give. The reality is, however, had they never picked up a cigarette or a vape in the first place, and they wouldn't be observing that deficiency because their body has not reprogrammed itself to need that extra compound, if that makes sense.
Mm-hmm.
One of the things I always think of to judge how damaging a habit is what happens when you take it away. So, for instance, drug withdrawal, alcohol withdrawal, vaping withdrawal, smoking withdrawal, they all cause very, very severe symptoms. If you've got a compound that is rewriting your body's chemistry to that level where it takes away and you're getting physical symptoms, that is a high indicator that you probably should stay away from it. And clearly there's exceptions to that, because you could say the same about air. You know, what about air? If I don't have air, I'm going to die. Yes, of course you are. Which is why you've got to look at the individual circumstances. But patients who have alcohol withdrawal are some of the sickest people I see in hospital.
Well, correct me if I'm wrong, but I think I'm right in saying this. There's only 2 substances that can kill you by going cold turkey. One of them is alcohol.
Certainly can. What's the other one?
I'm not entirely sure. It's either one of the opioids or fentanyl.
Opioid withdrawal can be fatal.
So it's heroin then. Look it up for me, Ben. But I'm almost certain that going cold turkey from alcohol can kill you. It does you.
I'd be amazed if benzodiazepine withdrawal can't as well. That's another very serious one.
Right. It might be those 2.
So diazepam, lorazepam.
Yeah.
Most things with a Pam at the end of it.
Yeah. Tommy and Pam. Yeah. Crazy addiction.
And it's a big problem because people use these substitutes for coping mechanisms for anxiety instead of addressing that the real problem is there. Not to say that these situations aren't unbelievably complex. Mm-hmm. But the more unhealthy habits you add to try and reduce those symptoms, the reality, the bigger the pit's becoming. Mm-hmm. We were talking about therapy before, which is one of the most important ways of addressing anxiety.
Yeah.
One of the most common types is CBT, cognitive behavioral therapy, which involves helping someone to adopt more positive thought patterns. So, for instance, someone who's suffering with social anxiety gets unbelievably anxious. They get physical symptoms in some cases if they are put in a social situation. Some of the symptoms of anxiety include, the most important symptoms of anxiety include high heart rate, obviously the feeling of anxiety, a lump in the throat. Some people get chest pain, some people get abdominal pain. And patients literally, I know that they don't believe me when I say to them that anxiety can cause this thing. They're like, no, there must be something wrong.
Yeah.
If I'm getting chest pain, there's something else wrong.
Yep.
The reality is anxiety, when it gets severe, can cause unbelievably real physical symptoms.
It makes you feel like you're dying. Having a heart attack.
I can't speak from personal experience on it, but some people certainly do mistake heart attacks with anxiety.
Yep.
Absolutely. But one of the biggest problems we have in healthcare is this one of the biggest problems that I see in healthcare is this expectation that the doctor is there purely to serve you rather than to work with you. Mm-hmm. And I hate this narrative of, oh, well, I'm not responsible for anything. Because if you adopt that mindset, then one of the conclusions that people sometimes take from that, well, if I'm not responsible, I have no power to change it. Well, clearly that's not true. One of the most important indicators as to whether CBT therapy is effective is the patient's engagement. But there are two of the scenarios in which CBT therapy is far less effective is in the case of unresolved trauma or environmental stressors. And for that reason, I think one of the most underutilized healthcare professionals is a clinical psychologist or a therapist, a counseling therapist, something like that, somebody like that. So these are highly trained individuals who will talk through at great length an individual's personal circumstance. What are the behaviors they're adopting that are damaging their life? What are the underlying reasons for this? Are there any underlying traumas which have skewed or shaped certain perspectives and led to people adopting unnecessary or unhelpful habits which are affecting them on a day-to-day life? I don't think that's a process that enough people go through. There is no substitute. There is no pill you can take that can substitute having a heart-to-heart with your friend.
No.
And that's essentially the mainstay of this therapy treatment.
Yeah.
Because if you can imagine, like, if we were to put people in different environments, the pathologies that they go on to develop become completely different. I'll give you an example we've seen, in the last few decades, we've seen an exponential increase in the number of children being diagnosed with ADHD.
Yes.
The reason for that is the 6 and 7-year-olds, probably younger in some cases, who are expected to sit through hours and hours of lessons on end and not go out and play and socialise. I mean, what's one of the most unnatural things that you can come up with? They've not got ADHD. You're trying to indoctrinate them with something that is clearly not appropriate for that age. So many problems about anxiety. One of the biggest problems we see in healthcare.
Yeah. And like you say, it's people not necessarily with the anxiety, but I made a video round about this time last year. I think it was last December. And I said something along the lines of, before you go, I said something like, it's December, January. This is the time when most people at some point are going to start to feel a bit depressed, a bit low. You've been drinking a little bit too much alcohol. You've not got enough sunlight. You've been stressed about Christmas, all of those things. And I said something along the lines of, before you go to the doctor and ask them for antidepressants, get a check in place of how much you're drinking, how much exercise you're doing. Are you seeing a male friend, if you're a male, once a week at least? Not talking about business, not going and getting pissed, just having a heart-to-heart, like you said. Are you taking drugs? Because cocaine's rife, and a lot of other bits and bobs now. Are you in shape? Get all of those things right. And then, if you're still feeling depressed, then go to the doctor. Because 99 times out of 100, once you get all of those things in place, you aren't going to feel depressed anymore. And it went fairly viral. I think got 1 million views maybe.
Yeah, it's absolutely true.
But again, in the comment section, this is what we talked about earlier about picking your fights. There was no end of people that were saying absolutely spot on advice, and there was even quite a few people that were carers in various. It might have been mental health carers and whatnot, saying absolutely spot on advice. But then you've got people coming on saying, how dare you say that? Some people's depression is real and this could cause somebody to commit suicide. So you're always going to have people in opposition. But I think in general terms, look, if you are manic depressive with schizophrenic tendencies, of course, going out for a walk in the forest is probably not going to do you that much good. In that case, you do need serious medical advice. But that's not most people. Most people they wake up in the morning, they're fatter than they used to be, they get out of breath playing with their kids, they drink every night, they've not got enough money coming in, their relationship with their partner's not where it should be, they barely see friends outside of work, which are just acquaintances, and it gets to the stage where they're just going through the motions. And I've been there.
Yeah.
And by addressing those things first, you're going to be a hell of a long way towards getting better. But, obviously trauma is a big one. And that's quite close to my heart because one of my friends has suffered from terrible anxiety, terrible stomach issues throughout their life. And it was only discovered in the last couple of years that there's been significant childhood trauma that had been forgotten and only presented itself to this person through therapy. And it was a very odd type of therapy where they used dots on a computer screen so that their eye could follow it around, which then taps into unlocking, I can't even remember what it was called, and is now going through a process of trying to heal this trauma. And all of these quirky, antisocial types of behaviour that this person displayed for as long as I've known them has all been because of this terrible childhood trauma. So, yeah, I completely understand what you're saying and agree.
Yeah, we have to ask ourselves the question, as you said, why are so many people diagnosed with anxiety nowadays? Why are so many children diagnosed with ADHD? You know, it's all these environmental factors. And one of the things Jordan Peterson, a clinical psychologist, talks about is unless you're having an interesting discussion with somebody in therapy, the therapy is probably not working. And I think there's probably an awful lot to be said for that. I remember speaking with a patient. One of the things about seeing a junior doctor that's quite nice is they generally have a little bit more time.
Yeah.
So, for instance, if I'm in a consultation in the GP surgery and somebody comes in with anxiety, I will try to go a little bit above and beyond and explore with them about what are some of the reasons into it. And one of these patients said, wow, you know, generally these are conversations that you can only have with a therapist. And I asked them why. And he said, a therapist will not judge you.
Mm-hmm.
You know, they will listen to your point of view and they will let you fully speak out and say what it is that's bothering you, why it is, what experiences have you had, without trying to contend it with another experience, which is frankly experienced by somebody else and is not going to encourage this person to fully talk out their mind. And it's fascinating, isn't it? So if you want to help your friends with therapy, listen to them. It sounds simple, but what does listening to them actually means? It means letting them talk out, not judging, fully exploring, you know, what are the underlying reasons to this.
Not
without
imposing your opinion.
Not imposing
on
your
them.
opinion or offering another experience which you yourself or somebody else has experienced. Not to say that there's not a place for that, but...
And also, don't you sometimes find as well when you're talking to somebody about something, it's almost as though, in a lot of cases, they try and throw out an experience that tries to trump yours.
Oh, of course.
Oh, yeah. Oh, yeah. Oh, yeah, I know you had terrible. But you never guess what happened to me when I was young.
Yeah.
I had X, Y, and Z, and it's kind of... It's... I guess, in a sense, what we need... at times, is not somebody to have a conversation with, it's somebody that we can talk to. A soundboard.
Well, that's what it means by listening. Listening does not mean waiting for your turn to speak.
Correct.
And that's ultimately the difference. A therapist understands that. Many members of the public do not.
Most members of the public do not. You know, it's infuriating. I mean, yeah, it's listening is a important and underused skill.
Yeah, of course. Why is therapy successful? Therapy is successful because they understand that listening is not waiting for your turn to speak, as we were saying. It's bizarre, isn't it? Because it's basic stuff and it makes complete sense. But, you know, why aren't most people aware of it? I don't know what the answer to that is.
I guess you only become aware of not listening to people when people pick you up on it.
Sure.
So I guess in a larger sense, it's possibly something that needs to be coached and taught. You know, you and I have obviously gone on self-development paths, reading books and writing and all of these types of things. So we have stumbled across how to make friends and influence people by whoever it was.
Dale
Carnegie. And you look at those types of books and read them and you take it on board, and then you've now got a frame of reference for when you're speaking to somebody. And I think I have, but doing these podcasts and listening back to them and getting feedback by people that I value their opinion, I've picked up on things that I needed to improve, and possibly listening and waiting for people to finish and reiterating what they've just said to me and then continuing that is a process. But most people don't ever even touch upon
I know.
that kind of thought process.
It's really interesting that you've named How to Win Friends and Influence People by Dale Carnegie, because I swear to God, this one book could replace the 5-year medical school curriculum. It just talks about social intelligence, but then you'd be amazed, even like 2nd, 3rd year medical students, you get into a communication skill lecture, and like they're talking about listen to the person, explore what it is that's worrying them. And there's some people in the class who it really, really benefits, because not everybody who goes to med school is a social character. By the time you come out at the end of it, generally far more so. And there's other people in the class who have read books like How to Win Friends and Influence People. And this is like teaching the alphabet. But by the time you come out of it 5 years later, generally everything, if you can imagine there's a huge range of skills and abilities, generally they have shrunk. The difference in that has reduced massively. But it is ultimately just social intelligence, and the lessons aren't difficult. I think it's a book that everyone in the world should read.
I totally agree. And I've even got a, whatever you call it, an abridged version or a condensed version that I have on an audio book, and I think the entire thing takes 30 minutes. And I will regularly just put that on in the car and listen to it over again and over again, because it is profound in its simplicity.
Yes.
But the depth at which you can kind of go into it in certain situations is unlimited.
Sure.
And yeah, it is a fantastic book. So
one of the most common lessons from it is if you want to be friends and get on with someone, learn their name. How many people in the work setting do a lot of people not know their names? I mean, I make an effort to know everybody's name in the reception, in the cleaning team, the doctors, the nurses, and it makes such a big difference. Know someone's name, know their birthday, know what they like to get up to, have something you can talk to, have something that you can talk to them about that they are interested in, and you've probably covered 75 to 80% of everything that was ever taught in communication skills in med school. Apart, obviously there are other aspects of it, like how to break bad news, because clearly if you're telling someone that they've got cancer, you cannot have a normal discussion with it. But if you're going to do it with someone you've already built a rapport with, most of it is actually in the pre-discussion and the relationship you've already got with them. Mm-hmm. And it's all taught in that book.
I wonder if
Ben's going to go and read it now.
He's already read it, haven't you?
Already got it.
He's already got it.
A couple of 3 books.
Audiobook. I wonder if the future may present a situation where a medical doctor isn't necessarily trained in medicine, but uses artificial intelligence for that, and your best doctors are the greatest communicators, the most humble and loving types of people with the medical background. Because, and I'm not belittling GPs one bit, because your knowledge is fantastic. My experience going to a GP is I sit there, I've got 5 minutes, I tell them what's wrong, they type something into a computer, they then come out with it's X, Y, or Z. They then type something into a medication computer, which tells them which medication is best for this. They write me a script and I leave. Now, you're obviously going to say there's a hell of a lot more to it than that, and I understand that there is.
Well, no, make your point, then I'll add my whatever I think. Yeah.
But what I don't feel a lot of the time, in fact, my original doctor, great chap, Dr. Gatora, had time, didn't mind if he ran over with you, knew my life, always mentioned things that had happened before, was genuinely interested in me. I don't feel I get that anymore. So maybe there's the human element is going to become more important, because the data on this has appeared on my big toe, it's going to be A, B, or C. The computer narrows that down. It spits out what antibiotic cream you need, and that's great. But at the same time, the person opposite me has found a little bit out about my social life, and that maybe I am drinking a bit too much, and in a nice way, maybe losing a few pounds might be, but done in a maybe that's the future for GPs.
Communication skills are without doubt unquestionably important, not just for medics but for everyone. I've never had a complaint in my life, and I have quite controversial opinions according to a lot of people. And the reason is, if you get to know someone, if you get to know your patients, you take a genuine interest in them, then they take a genuine interest in you, and they appreciate that give and take.
Mm-hmm.
I know doctors who are absolutely fantastic. Their medical knowledge is essentially a Wikipedia or an encyclopedia, who have more complaints every single month than you've ever had in your entire life. The things you say are far more outrageous. But you take a genuine interest in people, and that's the real difference. I mean, I've genuinely seen a doctor on a ward round. This patient, I can't remember exactly what the pathology was. I don't think there was one. They had some symptoms which they were very, very, very worried about. It became quickly apparent that there was nothing medically worrying. At the point it became apparent that there was no treatment to be, at the point it became apparent that there was no specific treatment or anything that was required, this doctor completely lost interest in the patient, barely listened to anything he said it will probably be all right, and then went off. That still leaves that patient unbelievably worried about it. They sent a complaint in, and I had to go back and, rightly or wrongly, I said I didn't want to bring it up with the consultant because wasn't very approachable, receptive. I don't think it would have yielded a good response, and that's something I would stand to now. But I still had to go back and fix it with the patient and explain to it. And once you've made that explanation, they're not worried. But if you're just going to take an interest in the symptoms and not the person in front of you, you're not going to be perceived as a good doctor, even if you are. And that's the reality of it.
My mind just still starts hovering around this idea that up until 2018, let's say, the type of person that needs to become proficient in this vast array of knowledge and remembering things isn't a social... That's not entirely true, because both you and I know a doctor that is probably both of those things, that's fairly good friends with us. But
multiple. We know multiple.
Multiple, yeah. But one that we both like. And
we both think of the same person.
Yes, we are. But generally speaking, the person that is able to retain all of this information and have this analytical brain and whatnot isn't necessarily the social intelligence, having time for people type of personality. But maybe now, with the invention of these large language models and artificial intelligence, maybe the most important element for somebody that cares for people, and I would also say the same thing in teaching, because I've seen multiple teachers that seem to hate children. They have no time for them. They're very good at regurgitating the lesson plan and whatnot. Their methods of control are antiquated and something that's stuck in Edwardian times or Victorian times. And I sometimes think, is that the same thing? Because the process to become a doctor or a teacher largely is about remembering facts, figures, and applying those in scenarios. It isn't about having that human touch.
It is a massive part of the medical school curriculum now. It has to be.
Is it?
Well, of course it has to be, because
but otherwise... even so, you're still having to attract those people that can take in large volumes of information.
Yeah.
I am not one of those people.
Sure.
I could not have become a doctor because I cannot remember these vast amounts of knowledge. Now, if I had all of that knowledge at my fingertips, I think I could. because I would care about the person and I would remember their name and I would be talking about things in a light-hearted way that's actually quite serious at times to get the best out of our interaction. All of those things that I've learned over the years as a tennis coach, as a PE teacher, as a friend, a brother, all of these things, I could bring to the table that you're socially awkward, embarrassed, kind of...
Sure.
You know what I'm saying, don't
Yeah.
you? So does the future hold something like that? Because I think AI is going to change dramatically the landscape in a lot of professions. And I just think those ones where you go to somebody and they type into a computer and the information comes out to them and then that's given to you via the person, I think they're largely going to be gone within the next 10 years. A solicitor, a secretary, an HR person.
Well, AI is certainly going to replace certain jobs quicker than others. I think
Yes.
recruitment is probably another one of those
Yes.
definitely at risk. I've seen Ben throw a
I know,
tennis
I
ball. I
saw
thought
it
it was
as
about
well.
to hit me. It's very interesting that what you said is, and it's one of the most common complaints that we see about doctors. Or every time I go to the GP, all they do is type in my symptoms into a computer.
Yep.
I do understand that. I think it's a valid point. The question I would put back is, would you rather have a GP who's prepared to check their knowledge and accept the possibility that they're wrong, or someone who's just going to go off information that they already know? I use a computer all the time
Yep.
when I'm seeing patients, but I can guarantee the difference is the way in which I or another medic uses a computer is not the same way in which a member of the public uses it.
Correct.
And the proof of that is everybody knows that person who likes to go and Google their symptoms. It's probably you listening right now. And then you take a very, very minor problem and then you find out, oh my God, it could be X, it could be Y. It's blown out of proportion. Clearly, when a GP types something into a computer, they're not coming back with, oh my God, it could be X, it could be Y, it's potentially really, really bad. No, they know exactly what it is. They know how to sift through the information critically. And in terms of the treatment, the reason I use a computer all the time to double check to decide the treatment is I cannot remember the doses of all the hundreds of drugs that I have studied in medical school. It's completely impractical. So it's far, far safer to go and just Google it, just double check, get it up on the treatment algorithm and don't make a mistake. I'm actually more worried about the GPs and the doctors who aren't prepared to use a computer for that reason.
Yeah. Yeah. No. Yeah. I totally get it. I totally get it. And I understand it.
With that said, have I ever had a patient who's come in where I've got absolutely no idea what it is, whack it into Google? Yeah, of course I have.
Yeah.
But still, again, you go through that process and if you are medically trained, you are far more likely to arrive at the correct conclusion without having erroneous conclusions far more quickly than another member of the public.
Yeah. But the question is, are these large language models going to become even more medically qualified than any human being that's ever lived? And really it's then just about inputting, and that becomes the skill. Because I can certainly produce an image on ChatGPT-4 now that is better than anything I've ever drawn, just with a few prompts. And I know that's very different to a vast database of knowledge. Well, it isn't in actual fact, is it? Because that's all it really is. I mean, I heard a story, I don't know what it was on. Somebody had taken their pet into the vet, so I'm not sure if it was a dog or a cat, and it was showing all of these symptoms, and the vet went through all of this X, Y, and Z. Nothing was fixing it. Essentially, the dog was just the cat was going to be left to die. The person went back, put the symptoms into ChatGPT. It came out with something that they'd never discussed with the vet. They went back to the vet with this, and the vet was like, oh my God, I never thought of that. Treated it, done, cured. So there was no human error involved in that, or whether it is human error, I don't know. And I think we're going to start seeing over the next decade more and more examples of that type of thing happening. It's the same as with self-driving cars. Yes, there are going to be some people that die in self-driving car accidents for the foreseeable. But that's far less than die from human error right now, and we'll almost be able to eliminate those deaths. So is there a situation where those poor diagnosis, the human error, the giving the wrong dosage of things is completely eliminated? I think there probably is.
If we look at medicine historically, medicine has improved every time that information and technology has been increased in its application.
Yeah.
One of the first examples of that is the replacement of drug paper charts with computer systems.
Yes.
The computer systems are predetermined so that the doses of all the medications are preset to the therapeutic doses. Every time a patient has an allergy and you try to prescribe that drug or a similar drug, a drug which falls into a similar class and therefore might precipitate some sort of reaction, a warning comes up making it essentially impossible to forget an allergy. As soon as that happened, errors went massively, massively down. And to say, is artificial intelligence going to play a part in future medicine is almost like asking the question. I mean, of course it will, because like computers can do far more things than, computers can do things that humans will never be able to do.
Yeah.
They can memorize an infinite number of drugs with an infinite number of side effects, possible applications, dosages, different dosages depending on age, weight, sex in certain cases. It's completely impractical to expect a doctor or anyone to memorize that sort of information, isn't it? So, yeah, absolutely. I think part of medicine is already how well can you use the artificial intelligence. Do you know that over 90% of drug errors in the NHS are caused by junior doctors? And the reason for it is, this is the reason for it. There's a multitude of healthcare professionals who can prescribe. This includes junior doctors, mid-grade, senior, nurses, I think paramedics in some cases, I'm not sure, a whole myriad of professionals. But most nurses who prescribe, they only do it within a narrow sector of medicine. It's a narrow selection of drugs that they do prescribe. In medicine, essentially in medical school, in most cases, you do one drug exam and that gives you access to probably 90% of all the drugs that you can prescribe. Yeah. So it's not junior doctors' fault at all, it's just how the system is built in. If you're going to have one exam, I mean, I don't know how to describe it. It's almost like saying if you pass this driving test, which is not fully suitable, you can go on every single road in the country, compared to someone who's only just passed but only able to drive up one narrow street. Do you know the point I'm trying to make?
Yeah.
It's interesting, isn't it?
Yeah. And again, that the AI will eradicate that.
What do you mean?
So it won't go down to junior doctors' lack of knowledge or lack of experience in certain things. The AI will know every single drug that's out there, like you've said, every side effect, every dosage. And as long as the input is correct, the output will be flawless.
Sure.
Just like you use it to write a script now, and you know there is no punctuation errors, there is no spelling mistakes, there is no grammar mistakes. It just does it. A little bit like self-driving cars will be like that. In the future, they will be flawless and errorless. They will be. It just has to be that way. But in order to get there, there's going to be a few crashes.
Of course, yeah. And we talked about this last time, didn't we? One of the video that went viral was this uptake of people finding it so astonishing that we still use bleep technology.
Yes.
I showed it to one of the GPs and he commented, God, we used to use bleeps in 1997. I was born in 1997. That means we've literally taken a baby to a junior doctor quicker than we have replaced the bleep system. I mean, that is just, when you put it like that, it's unbelievable. Mm-hmm. More technology, without doubt, needs to come into medicine. This is how ineffective medical handovers are. Every time you get a bleep, you have to do handwritten notes, as we've discussed. The most bleeps I've ever seen anyone receive in an hour is 12, and I can say now that doctor achieved basically nothing. They would have spent the entire time responding to bleeps and making the notes from it. Every time you have an uncompleted task, you have to keep your notes and present them at handover, which means by the time you get to the end of your shift, you've got a long list of notes for tasks that you've essentially not dealt with.
That the next person has to deal with. Is that right?
It's even worse than that. At the handover meetings I was present at, there were between 10 and 20 professionals there. Nobody can read anyone's handwriting.
Yes.
So that all the last hour, which I've spent essentially writing notes and not doing my job, they now have to copy out their handwritten notes of the notes that I've already taken before going out and dealing with it. It's like this could literally be replaced in an app.
Yeah.
And a handover which takes 45 minutes could be reduced to about 10. Of course, you can still have some input. Is there anything else I need to know that there's probably not written on it? But that's the same as the note system that we've got anyway. It's absolute madness.
And why is there such resistance to change? Why has this not been addressed? Because it sounds so simple.
One of the reasons it's taken so long to replace the bleep system is the instability of internet connections across various healthcare providing settings in the country. That is now something that is essentially should not be. It should be a consideration, of course it should, but the reality is every single NHS healthcare building in the country now which provides face-to-face patient care has internet connection. We have to appreciate that this is something of the past. It's interesting because one of the points in, I think it's the emergency room in the hospital that I was working at, doesn't pick up bleeps. So we consider them to be this flawless system, which are very, very reliable. And I think that is true in a way, but they can still run out of battery. It's still very difficult to identify where all these different numbers have come from.
If you were to take into consideration all of the, we're just going to say deaths because it's easy to visualize that. All of the deaths that are caused because these handovers are taking 45 minutes, the bleep's not working sometimes, compared to the number of deaths that may occur because the internet signal dropped out, I think any logical mind can straight away say that the old method is going to count for far more than the new method would.
Because the internet is so unlikely to drop out, you mean?
Yes, it is so unlikely to drop out, isn't it? I mean, you of course you're going to get instances, but you'll get, like you've just said, you're getting instances of the bleepers not working.
But we're so reliant on computers anyway.
Yes.
Yeah.
Banks and huge businesses that are profit orientated aren't worrying about the internet dropping out for 10 seconds a day. And I know dealing with lives is you hope open up a can of worms. Dealing with lives should be more important than money. Is it? In a lot of aspects. I don't know.
It is in certain ways, but the reality is a huge proportion of people in society deal with people's lives. I don't like the fact that doctors are put on pedestals. If you look historically, you could make an argument that a plumber has saved just as many lives as a doctor by providing a clean water system. Yes, it's probably not. It was probably a medic who identified that this is something that's very, very important, but it's still them who's gone and implemented that system.
It's quite a good point, actually, because I was going to mention this to you, but what do you think has had a more significant impact on the increase of humans' lives? Is it the invention of sewers or modern medicine?
I think the two most important indiscriminate health advances that we have made are vaccines and clean water.
It's sewers.
Well, there you go. Clean
Sewers.
water, yeah.
The sewage system, the increase in lifespan went up X amount, and then since the invention of modern medicine, it's gone up a very small fraction of that. So if an entity came to us and says, right, one of these two things has to go and can never come back, one is the sewage system and one is modern medicine. Modern medicine would have less of an impact.
Oh, 100%.
Which is crazy to think, isn't it? But so yeah, you're right. The electrician that's installed the correct wiring in a system has been responsible for saving X amount of lives, but it's not there and then. It's almost,
of course.
It's not seen. Whereas the doctors are seeing these people that are coming in and they are dying, and they are fixing it there and then.
Yeah.
You know, who's more responsible for car engines not blowing up, the mechanic or Toyota that are designing the engines and putting all of the money into the R&D? And it's the same kind of thing, isn't it? We only see what's presented and binary in a lot of senses. This person's going to die, this person saved them. Job done. Whereas you can't put a number on it. I think I need to pick my daughter up soon. So it's been a very good conversation again. 2 conversations. One was recorded and one wasn't. I'll keep you posted on how the carnivorous diet's going, and we'll do it again.
Thank you, sir.
Thanks for coming. Calm. Right, Ben.